Thank you very much, Dave. I appreciate what you do, and I appreciate your comments, and I appreciate your sense of humor, and also the ability to tie in something personal in all this, because at some point it is personal. Looking a little bit now from what's happening from a Department of Corrections perspective. The Department of Corrections was created in 1983. It used to be part of the Department of Health and Human Services. But it seemed to be that time when we were making departments. So it was interesting that about that time when the department was formed, it was also about the time that community-based corrections in the state was recognized as one of the leaders in community-based corrections in the country. And I believe that community-based corrections continues to hold that level of respect. I don't think we could do the work that we do in the institutions if we didn't have community-based corrections with us. So I think it's really important to acknowledge that. We have had several opportunities along the way from 1983 to implement change. We've decided that we needed to be able to track what we were doing. So we made a change from a database that nobody else could see, that was actually run by somebody else, and created a database so we could begin to follow what was happening with an offender from the time they entered correctional supervision until the time that they left. That database now allows us to do the things that an evidence-based learning organization can do. Not only can we give you facts and figures, but we can tell you what works and what doesn't work. So one of the first things that I think that we did to get us to where we are today is the recognition that if you're a learning organization and data is driving what you're doing, we need to get that data. And that's been one of our biggest assets. I also think that we've recognized the importance of evidence-based practices as a science that can guide us in the work that we do. That if we follow those practices with fidelity, if quality assurance surrounds everything that we do, if staff are trained in the skills that are defined as core correctional practice, we can reduce recidivism. And we started recognizing that probably 2005, 2007, as we began to recognize that research should guide what we do. And from that time until to now, I think that we've had what I would call pockets of excellence. That there are places where people and the leadership that is provided have said, I'm going to implement evidence-based practices with fidelity. I'm going to train my staff in the skills that they need to have. I'm going to measure our outcomes, and I'm going to make sure that we're investing our resources in what reduces recidivism. I think it's time that we have an opportunity that is brought before us today to say, let's make Iowa a pocket of excellence. So our goal as a Department of Corrections today is to say that as a learning organization that we need to change and make sure that everything that we do in our business, the infrastructure of our business, is consistent with recidivism reduction. And as Dave said, and as Lieutenant Governor said, and as the Governor said, but we can't do this work alone. I think the important thing about today is not only recognizing that the department is committed to implementing evidence-based practices, to making sure that the work we do is consistent with recidivism reduction, but it's reaching out to partners in the community that have to be there with us to do the things that we need to do to make our communities safer. I think one of the things that helps us today, and I would like to thank ODCP for helping us get to this point today, and writing the grant and fulfilling the implementation that came along with this. We greatly appreciate that and the opportunity that you've presented. But I think what we're talking about today has been reflected in many comments you've seen. An interagency collaborative effort is required if we are going to be able to make Iowa the safest state in this country. So today is the beginning of that conversation, full-throttled and with energy and with a commitment. Because if you look at, I spent some time one night when I was trying not to work, looking at other state agencies' websites, and almost every one of them had a similar kind of thing. It said, "I want to provide opportunities for people in our communities to be safe and successful." To be safe and successful. We share that in common. So let's look at some ways that we can work collaboratively and break down those buildings that we have and work together to make that promise that we all are trying to promote a reality. I would like to thank the Council for State Government for their support in this initiative. I had a chance to meet Denise O'Donnell a week or so and heard the same kind of message that she talks about now. And I think we are at a time where people are beginning to say that there needs to be some change in the way the criminal justice system is administered, that justice needs to be part of what we're doing. And that people in the criminal justice system should have an opportunity to understand the harm that they've caused, an opportunity to address some of the needs and problems that contributed to their criminal behavior, and an opportunity to find a job, to get back with their families, and to be parts of our community. So as I look around the room, I see the Board of Parole, and I got to tell you, there isn't a day that we aren't in each other's offices talking about a case and identifying that mission as public safety as being core to what we do. I look around the room and I see public safety represented, I see human service represented, I see aging, I see all these divisions talking to each other. And I really need to thank the executive branch and the governor for pulling state agencies together and not just saying, I think you should do this, but saying you will do this. And I think it takes that level of leadership to do the things that we're capable of. One of the things that has often happened with grants like this, and we've been the benefit of several other grants before, but typically those are focused on a specific population. We want to do better with people with co-occurring disorders, or we want to do better with women. And so we target a bunch of resources on a small population and do some things that we think are going to make things better for that group. But then we invest most of that money in staff. And then the federal funding runs out. And it's a challenge to sustain those kind of programs. So one of the things that I'm very proud of with this grant is sustainability was part of the design. That there are only 3 people, very powerful and influential people, that we hired to be part of this initiative. But we're investing that money in the people that are doing the work, with the people that we're partnering with the citizens in the state of Iowa who have a vested interest in this, because we believe that organizational change and collaboration sustains. So that's one of the key elements of this grant, and that's another reason why we're having an event like this today, to underscore the importance of collaboration and sustainability, because what we do for the next 2 years, we anticipate will be the product that we're going to be working on for the next 5-10 years, until the evidence tells us that there's some things that we may need to look at differently. So it's an important day for the Department of Corrections, an important day for the state of Iowa. I appreciate all of you being here today, and we're going to now hear from one of my very favorite people in the whole wide world. I've got a lot of favorite people, but you're one of the most favorite. Dr. Mary Chapman. I first met Mary when I first started working on reentry back in 2005, 2006 with the Serious Violent Offender Reentry Initiative. And Mary was working at DMAC, and she was committed to serving those that were underserved, which oftentimes included people that were under correctional supervision. And she's been committed to improving the outcomes for African Americans for a long, long time, and I value her so much. So from a perspective from the community, I'd like to introduce Dr. Mary Chapman.